You go to your doctor complaining of fatigue, brain fog, or achy joints. The doctor spends 10 minutes with you and orders standard blood work. A week later, you hear those frustrating words, "Everything looks normal." It's just part of getting older. Welcome back to Health Pulse Haven. Feeling exhausted is not an inevitable part of aging. Standard panels run at physicals are designed to catch major diseases, but they frequently miss the underlying imbalances that dictate how you feel every day. When we cross into our 60s, our bodies change how they absorb nutrients. If you only get basic tests, you only get half the story. Today, we break down the critical, lesser-known blood tests you must explicitly ask for to take control of your health. The first test you need to request is the hemoglobin A1C. Doctors usually check your fasting glucose. That is just a snapshot of your blood sugar at the exact moment the needle went in. It misses the bigger picture. The A1C test measures your average blood sugar over the entire last 3 months. Millions of adults over 60 have prediabetes and have no idea. When blood sugar is chronically high, sugar molecules bind to red blood cells, coating them in a sticky glaze. This damages delicate blood vessels, causing neuropathy, vision changes, and chronic fatigue. By the time fasting glucose shows a problem, damage has already started. The A1C test catches it early, giving you the power to reverse it through dietary changes before it turns into type 2 diabetes. Test number 2 is a lifesaver rarely ordered unless you ask, HSCRP. Doctors always check cholesterol to assess heart attack risk, but half of all heart attacks happen in people with completely normal cholesterol. The real culprit is hidden: chronic inflammation inside the arteries. Chronic inflammation is a slow-burning fire inside your blood vessels. It irritates the artery lining, causing plaque to build up and rupture. The standard CRP test looks for massive inflammation from infections, but HSCRP measures the low-level, silent inflammation that damages your heart over time. If levels are high, your body is sounding an alarm, giving you time to change your lifestyle before a cardiovascular event. Next is a fascinating test called ferritin. We hear about older adults not having enough iron, leading to anemia. But there is a flip side. As we age, specifically after 60, our bodies can start to hoard iron. Because men and postmenopausal women no longer shed excess iron naturally, it slowly builds up over decades. Ferritin measures your stored iron. When stored iron gets too high, the body deposits it into organs like your liver and into your joints. It is essentially like your body is rusting from the inside out. High ferritin causes severe joint pain in the knuckles, liver damage, and lethargy. People suffer for years thinking they have arthritis, when they actually have iron overload. It's easily treatable, but you must test for it. Tests 4 and 5 are crucial for protecting your brain: vitamin B12 and homocysteine. As we age, stomach cells produce less acid, making it incredibly difficult to absorb B12 from food. A B12 deficiency perfectly mimics the early signs of dementia: memory loss, severe brain fog, confusion, and poor balance. But you must also ask for a homocysteine test. If your B12 is low, an amino acid called homocysteine builds up like a toxic sludge in your blood. High homocysteine aggressively damages blood vessels and actively shrinks the brain, massively increasing your risk for cognitive decline and stroke. Lowering homocysteine through proper, targeted supplementation is one of the single most effective things you can do to preserve your memory. If you suffer from night leg cramps, poor sleep, or unexplained heart palpitations, test number 6 is for you: the RBC magnesium test. Magnesium is the relaxation mineral. When a doctor runs a metabolic panel, they check blood serum magnesium, which almost always comes back normal. Why? Because only 1% of your body's magnesium is in the blood. The other 99% is inside cells and bones. The blood robs the cells of magnesium to keep the serum stable, making standard tests practically useless. You must ask for an RBC, or red blood cell magnesium test, which breaks open the cells to see the true level. Finding out your true intracellular level can cure chronic insomnia and restless leg syndrome almost overnight. Finally, test number 7, a complete thyroid panel. Your thyroid is the master engine for your body, controlling metabolism and energy. When you complain of fatigue, doctors usually only check TSH, a brain hormone. If your TSH is in the normal range, they say you are fine. To get the actual picture, you must ask for free T3 and free T4. T4 is the storage hormone, and T3 is the active hormone that gives your cells energy. As we age, we often struggle to convert T4 into T3. You could have normal TSH, but zero active T3. An underactive thyroid ruins your metabolism, making you gain weight no matter what you eat and draining your energy. You need the complete panel to know the absolute truth. You are the CEO of your own health. The next time you go for a physical, don't passively accept whatever tests they run. Take a pen and paper. Ask for the hemoglobin A1C, high sensitivity CRP, ferritin, homocysteine, B12, RBC magnesium, and a complete thyroid panel. Don't settle for the phrase, "you're just getting older." Getting older should mean getting wiser, not living in pain. If you learned something new today and want to take real control of your health journey, please hit the subscribe button and join our Health Pulse Haven family. Let me know in the comments below which of these tests you are going to ask your doctor for first. Stay informed, stay healthy, and I will see you in the next video.